Today I welcome you all to our 28th AFOMP webinar series, part of the series. And today I welcome the webinar team, Mohammad Jobairul Islam as a moderator and Professor Arun Chougule as a speaker of the day. So Mohammad Jobairul Islam is the medical physicist and radiation control officer at Lambert Cancer Hospital and Super Specialty Center, Dhaka. Dr. Jobairul Islam has completed his graduation and post-graduation in medical physics from Gono Vishwavidyalaya. He has completed MSc thesis and internship from University Medical Center, Mannheim. He also worked as a program coordinator for SCM-PCR. It's not a new name to us. It's quite well known now. Further, he has also contributed to SCM-PCR as an editor of a biannual newsletter. And he's currently working as an medical physicist and RCO at the Department of Radiation Oncology, Lambert Cancer Hospital, and a super specialty center, Dhaka, Bangladesh. He has presented various he has presented quite a good number of papers in various national and international conference, and was an organizing joint secretary for 21st AOCMP, which was organized in Bangladesh. Jobairul Islam has also contributing intensely to BMPS since 2013, and currently he's a secretary of Bangladesh Medical Physics Society, BMPS. So today we have a pleasure to have him with us. So now I hand over the floor to Jobair to continue with the program. So Jobair.
Thank you, Dr. Razni. Good day, everyone. I thank Professor Dr. Arun Chougule and AFOMP to give me this opportunity to moderate this webinar. So as part of the celebration of 20th anniversary of AFOMP, we are going to deliver today the 28th monthly webinar. Now, I welcome to our respected speaker, dignitaries, and everyone in monthly webinar on global medical physics scenario and need for interdisciplinary approach. The webinar is endorsed by the Australasian College of Physical Scientists and Engineering in Medicine. It's accredited with 2 CPD points. Medical physics is an interdisciplinary science that from knowledge, methods, and techniques of physics help solve current problems of medicine, primarily regarding of medical imaging, radiotherapy, nuclear medicine, and radiation protection. These applications are not exclusive, but this practice determined in existing of the figure of medical physicists, hospital clinics, and other area of the practice of medicine. Now, I am going to today's speaker, who is very renowned professor in medical physics world. He is none other. He is Professor Dr. Arun Chougule. Dr. Arun Chougule is a Dean and Chief Academic Officer, Swasthya Kalyan Group of Institutes, and he is also ex-senior professor, Department of Radiological Physics, SMS, Medical College and Hospital, Jaipur. He is also serving as President, Asia Oceania Federation of Organization for Medical Physics. He is a chair of Education and Training Committee and Accreditation Board of IMP and member board of the directors at IMPCB. He also has served an expert to IAEA. He is also Dean Student Welfare, Rajasthan University of Health Science, member board of the Management Academic Council RUSS, chairman Unfair Means Redress Committee RUSS, ex-president Association of Medical Physics of India. He is also ex-pro vice chancellor RUSS and associate editor for medical for Physica Medica RPT and IJMP. He is also numerous editorial board member including Medical Physics International, Korean Journal of Medical Physics, and IJMP. And he a reviewer for Journal of Medical Physics, Acta Oncologica, Journal of Radiotherapy. He is also involved in supervising and guiding PhD in Radiation Physics RUSS and Paramedical Sciences RUSS, Jaipur. He has been awarded with numerous fellowships, mainly IOMP IDMP 2016 Award for Contribution in Medical Physics, AFOMP member Excellent Presentation Award. He has also been received Outstanding Faculty Award 2019 of SMS Medical College. Dr. Farooq Abdullah Sherry Kashmir Based Research Award 2011 to 2012. He has been also awarded AFOMP Outstanding Medical Physicist 2020 for his contribution to medical physics, education, research, and professional development. His contribution to health sciences and awarded prestigious Fellow of National Academy of Medical Science in 2021 and also Fellow of AFOMP. He is the recipient of various fellowships such as IC, RETT, EYCC, ASTRO, VLIR, ICTP, TWAS, UNESCO, TAWS, CAS, DAD, and regular associateship of ICTP. I've requested to everyone to mute their microphone during this session. Participants are requested to put the question in the chat box, which will be answered at the end of the talk. Now, I invite Professor Dr. Arun Chougule to deliver his talk on global medical physics scenario and need for interdisciplinary approach. Sir, now floor is on.
Thank you, Muhammad Jobairul Islam, for your kind introduction. Good morning, good afternoon, and good evening to all of you. The place you are there, it may be morning, it may be afternoon, it may be evening. Today, I'll be talking on global medical physics scenario and the need for interdisciplinary approach. And I have divided this talk into two categories. One is the scenario we'll talk about and why there is a need of more interdisciplinary approach into the medical physics. Being the president of the AFOMP, chair of the ETC accreditation board and IMPCB, I know the situation and what is needed to be done in this field. Very exciting, very applicable field as a healthcare professional, and therefore I thought I should speak with you with this. No disclosure, no conflict of interest. As you know, International Organization of Medical Physics celebrates IDMP every year on 7th of November since 2013. And this year's IDMP theme is Medical Physics for Sustainable Healthcare. A very important self-explanatory that if the healthcare is to be sustainable, the medical physics education, they can contribute hugely to this field. And if you look at the flyer, it's the education, data science, research, innovation, so many things are there. Also, we do celebrate the week, that is the International Medical Physics Week, somewhere in April, May, and this is all the themes of the IDMP if you look at, and how importantly the IOMP has given stress on education in medical physics, key to the success, and without medical physicists you cannot think of radiotherapy, radiation protection, many other fields. And this year's theme I talked about is a medical physics for sustainable healthcare. And this was the theme, education in medical physics, key to the success, very, very important, because medical physicists are health professionals dealing with the well-being of the humankind, and they are not, it's just not an academic education, but the professional competency required must be of a very, very high level. Medical physics is started long ago, before the discovery of X-ray and radioactivity. After the discovery of radioactivity and X-rays, the radiological physics or application of radiation has given the boost to this medical physics. And Jean Hele, who was a professor of medical physics and hygiene, Faculty of Medicine in Paris during 1795 to 1822, he defined what is this medical physics is. it's an application of physics for knowledge of human body, its conservation, and for cure of the illness. And if you look at the 21st century, physics for conservation of health, it is not just the diagnosis and treatment, but by application of physics of cancer, many diseases, the data mining, large data, we can predict the diseases before it appears, before it becomes a problem. And it is not just the diagnosis and treatment, the physics for conservation of health, and therefore our education, our training, our competency should be in that direction. Now, medical physics is growing very, very fastly, and the technological revolution has taken place in the field of medical physics. Let it be radiotherapy, let it be diagnosis, other areas, and disciplines like medicine, physics, and biomedical engineering has converged, and science has no borders or boundaries. They have to converge for a betterment of the mankind, and that is how it has happened. And therefore, this unprecedented surge into the medical physics competency required for implementation of specialized physics-oriented, physics-disciplined technologies like particle therapy, image-guided therapy, intraoperative therapy, advanced imaging, nuclear technique, has put a lot of onus and pressure that our education, our curriculum has to tune with that the technologies. And if you look at in last 2-3 decades, there is a revolution into the imaging technologies and their application into the radiotherapy also, because now you cannot think of a radiotherapy without CT, MRI, or guided imaging technologies. And some of the imaging technologies are very high radiation generating, and therefore role of medical physicists as a radiation protection expert also is there. And as I talked into beginning, that there is no borders or compartmentalization. It is the medical physics is engineering, mathematical, biology, medicine, chemistry, all. And therefore, we have to converge all these sciences to make medical physics and the sustainable healthcare their role of medical physicists. And because of the increasing demand of the medical physicists across the world, because if you need to implement, you need to have a radiotherapy, radiation protection, imaging devices using radiation, you need the services of the medical physicists. Without them, you cannot have many countries and many places. It's a mandatory requirement. And therefore, IOMP, IAEA, WHO has initiated many things, and across the world, many educational programs have started. And they are academic program at the university level or the institution, and then the hospital training, what we call a structured residency program. It is very, very must. And IAEA makes it what is called as a clinically qualified medical physicist. The medical physicists who work into the healthcare domain, into the hospital with the patient, they need to have the clinically qualified medical physicist, the competency required. And therefore, the medical physics education or the medical physicists who are working in these areas, because the technology has changed, the approach has changed, because earlier it was a physical dose. It was what we call as ISO doses. Now it is a biologically effective dose. It is a ISO ERDs, and it is not the homogeneous dose distribution, and the component of the biology, understanding the disease or diagnosis, always at the treatment, is very, very important. And therefore, component of the biology is very, very important into the education. The Global Task Force on Radiotherapy and Cancer Control has given its report in 2015, and they have addressed the global shortfall of radiotherapy center, which are required for treatment of the cancer. Cancer is a second killing disease. In many countries, it has become the first killing disease, and more than 60% of the cancer require treatment by radiotherapy. And they have assessed and they have communicated that in low middle income countries itself, in coming 10 to 12 years, we need more than 13,000 more teletherapy units. And then to take care of this teletherapy machine, the radiotherapy planning, QA/QC, radiation protection, we need additional 22,000 medical physicists only for radiotherapy. The medical physicists do not work in radiotherapy. They also work in radiodiagnosis, in cardiology, and many other fields. And if you look at the global scenario, almost 20 million cancer patients every year. Mortality rate, if you talk about more than 10,000 cancer patients die every year. Across the globe, it is mortality rate is 52%. But in LMI countries, the low middle income countries, it's more than 70% of the deaths are occurring in the cancer because the facilities are not there. And if you come from north to south down, you see number of radiotherapy facilities required. The Latin America, the Africa, the Asian region, there's a huge gap in north and south. And therefore, there's a huge potential for expansion of the radiotherapy facilities, the imaging facilities, and therefore the number of medical physicists required. If you talk about the number of equipment and population per radiotherapy equipment from the Western Europe, USA, and down to the Southern East Asia, Middle East Asia, East Asia, you will see that 10 to 30 times more equipment. There's a shortage of 10 to 30 times, and that need to be enhanced. Population per RT equipment, if you talk about the Western Europe, it's a 50 to 60,000. But if you look at the Asian countries or African countries, it's 1.7 million. So there's a shortfall of almost 25 to 30%. And this, if you look at again, as you go from north to south, the number of, this is direct data from IAEA, number of the radiotherapy equipment, also required the diagnostic equipment, and then the manpower of medical physicists is required. Now, application of physics in medicine, it is majority is radiotherapy, diagnostic radiology, nuclear medicine, radiation protection. In addition to that, cardiology, neurology, ophthalmology, otology, surgery, and many more areas where medical physicists can contribute in these areas. And therefore, across the world, many education programs have been started, and almost about there are 370 medical physics education program. The entire list is available on the IOMP website. If you look at the different regions, AFOMP region, if you look at, though we have around 117, 118 medical physics education program, but the population of the AFOMP or Asia Pacific is more than 4.5 billion. 60% of the world population lives in this area. The number of programs are just 0.029 program per million population, as compared to Europe, as compared to the Canada, they are much less. And therefore, this medical physics education program need to increase. The number of candidate trained need to be increased. According to IAEA, how one can become a clinically qualified medical physicist is that he or she must have a graduation into science or engineering, and after that, minimum 2 years masters in medical physics program, and after that, minimum 2 years of the structured clinical in-service training in the hospital in an area of radiotherapy or radiodiagnosis or nuclear medicine or other medical fields. That is a must. and then only he or she can become a clinically qualified medical physicist. There is a radiation oncology medical physicist, radiodiagnosis medical physicist, or medical physicist, and then every 5 years he or she has to acquire some CPD point to maintain her registration, her certification, or his or her both. That is very, very important. Mere academic training will not be sufficient to work as a clinically qualified medical physicist. And here you can see that basic degree and then post-graduation, then supervised clinical training, minimum 2. Some countries have 3, some countries have 4, some countries have 5 years residency requirement. And after that, you need to acquire, you have to be certified, and for recertification, you should have some CPD points. I will talk about that thing. IOMP policy statement number 1 recognizes medical physicists as health profession, ILO, IAEA, WHO. And therefore, IMP policy statement number 2 gives you the basic requirement for the education of the medical physicists, how many, what topic, how many areas and all. And IAE also brings out a lot of documents and all. And therefore, our medical physics education program must be highly technically qualified, structured, and all those things has to happen. And therefore, there are a lot of, see, even if you see the IAEA BSS this thing, it makes the medical physicists are the health professionals categorized as a health professional, and therefore their training, their competency must be assessed. They must be certified. The educational program must be accredited. They must be registered as the health professional. And many government, many countries are moving it already. Some is mandatory, some are moving in that direction. IAEA brings out a lot of documents, and you can find out on the website. And then last year, they brought out guidelines for certification of clinically qualified medical physicists. What is the procedure and how you can do it, who can do that. And recently, just about a month back, audit of methodology for medical physics clinical training program. It is not just a mere year, 2 years or 3 years you are posted in a hospital and then that is residency. But there should be audit of their training, the equipment, what they have got, the task they can perform, and the competency they get. So auditing of that thing just recently IAEA has brought out. I will just talk about the IOMP, International Organization of Medical Physics, which has it was established in 1963, and now 90 members organizations are member of IOMP, and the recent new one is the Jamaica one. It represents almost about 35,000 medical physicists. It has 6 ROs, regional organizations in FAMPO, that is AFOMP, European, ALFIN is Latin America, FAMPO is Africa, MEPOM is Middle East, and CPOM. And if you talk about the AFOMP, they represent about 11,000 medical physicists, 21 countries. AFOMP also brings out a lot of guidelines for education, for their recognition and things. And we have a very dynamic website. And if you look at the policy statement, number 1, rules and responsibilities, status of medical physicists, manpower requirement, the education, and the CPD accreditation, the ethics, all these guidelines are available on the AFOMP website. If I talk just about the AFOMP region, that is the Asia Pacific Ocean region, we have various status of medical physics in Asia Oceania region, because we do not have a European Union like collaboration or guidelines. Every country has their own education system, their own system of accreditation and all. So we have various status of medical physics in Asia Oceania region, diverse culture, education, economic background, and there is a shortage of medical physicists. Though we have 11,000, the population I talked about is a 4.5 billion plus, and many Asian countries' economy is growing fast. The radiotherapy facilities are increasing. There's a demand, more and more demand of medical physicists. and so we need to enhance. And many medical physicists, they do migrate to Europe or USA or other countries, and also there's a lack of recognition of the medical physics standard practice in this AFOMP region. And to enhance this thing, recently we have a collaboration with the European Union. We have signed an MOU. Also, already we have a MOU with MEFOM, so we can. And if you look at, I talked about the medical physicists required in radiotherapy, 23,000 in LMIC countries, but there is a requirement in radiology or interventional procedures also. And many countries have made it mandatory. If you look at many countries, the number of medical physicists in radiology, exclusively I'm talking, is very, very minimal, excluding only few countries like Australia, Hong Kong, or Indonesia, because there's a law that any center using very high radiation or intervention radiology or CT, they need to have the services of the medical physicist, and therefore the number is high. So every country has to go. As I talked about, almost about 12 countries in the AFOMP region, they are running the medical physics education program. Most of them are 2 years medical physics education program, but many countries do not have the structured residency program, or the residency program is only of 1 year. So that has to be tuned with the IAA requirement structured, and that is here MP residency program. If you look at, many countries do not have a structured, some have only 1 year or 2 years, and that needs to be enhanced, that needs to be corrected. Even registration of the medical physicist as a health professional or the allied or health sciences, only about 40% of the countries have the mechanism to register them. Many countries do not have. So if you look at the history from 2000 to 2020, yes, the total number of medical physicists number, which was around 1900 in 2002, has gone to 11,000 in 2021-22. But as I told you, looking to the population, looking to the requirement, this number is not sufficient. If you look at other region, US and Canada, number of medical physicists per million population, if you look out, it's about 25 medical physicists per million population. AFOMP has almost 12, and now they are increasing, going to 18. But if you look at the AFOMP, it is hovering around 2.2, 2.3 or 2.5. So we have to enhance our medical physics education capabilities. Even if you look at the total number of machines from 2002 to 2020, a 5-fold increment have taken place into this. But as the complexity of the treatment modalities have also changed, it was earlier the very premier, you can say central axis debdosa, isodosol. Now we have IMRT, IGRT, particle therapy. So number of medical physicists required and the competency is based on the complexity of the treatment modalities required. And if you look at just a brief idea about the countries in Asia Pacific AFOMP region, the number of medical physicists and teletherapy units, if you look at the countries like Australia and countries like the Mongolia, Myanmar, and other countries, if you look, it's a 20-25-fold difference in the availability of the teletherapy units, the number of medical physicists required. So there is a huge scope for requirement. Therefore, we have to see the medical physics education, the capacity and their knowledge and skill, not for today, but for the tomorrow, for a futuristic approach. And if you go with that thing, huge number, at present itself about 6,000 shortfall of medical physicists in the AFOMP region for radiotherapy, 6,000. Leave aside the diagnosis, nuclear medicine, other areas. So there's a still huge scope to escalate our medical physics education program. And at the same time, it's not just the quantity, the quality of the medical physicists also is important. And as you can see, many countries in the Asia are embarking upon the high-tech radiotherapy, like the particle therapy. China, Australia, India, Japan, Korea, and you can see number and the projects coming up. And we need to, behind this, the very highly competent medical physicists to take care of this high-tech radiotherapy technologies. Very important, this thing. And therefore, I told you that individual medical physicists need to get certification. That certification can be from your national certification body, your national organization which has been authorized by the government of your country, or international certification body for a certification. And then this is what individual medical physicists get certified, and then recertification after that, accreditation of the medical physics education program. Your medical physics education program, does it have the same kind of curriculum, the infrastructure, the faculty, the equipment, practical and design? That is very, very important for them. And then this has to lead to registration of the medical physicist with the regulatory authority of your country as the health profession, and you are licensed like physicians, like nurses, like a pharmacist, to as a health profession, as a medical physicist, a health medical physicist, as a licensor. This mechanism has to happen. Now, what do a medical physicist as a health profession need to have is a professional competence, and that has to be certified, that has to be accredited, educational qualification, problem solving, and that. And therefore, my IOMP, the WHO, the IAEA is trying that the medical physicists get individual certification after assessing their competency. The medical education programs gets accredited so that the standard is maintained and they work. Many countries, USA is the beginner, they have started that thing, and you know that accreditation, Commission on Accreditation of Medical Physics Education Program, CAMPEP is there, which is accrediting their medical physics education program, and they have ABR and other boards to certify individual medical physicists. Canada have CCPM. If you look at the UK, IPM is there. Australia has got the Australian ACP, SEM board. Japan has got the Japanese Board of Medical Physics. South Korea has got Medical Physics Certification Board. India has got College of Medical Physics Certification Board. Europe and that. So many other countries in Asia do not have their certification board. They need to do. So IOMP has brought out the IOMP accreditation board to certify, to accredit the medical education program, and as per the IOMP policy statement 2, and also the IAEA document, IOMP accreditation board accreditates the medical physics education program initially for 3 years, and after re-accreditation for 5 years, and it was started and it is being done. Also, IOMP accreditation board accreditates the CPD educational programs and the residency programs also, and this is the board for 2020 to 2025 from all the areas, and we do, and that I told you that IEF publication, training course series 56 and IOMP guidelines, the IOMP accreditation board follows when they undertake the inspection and do this. And as of today, we had already accredited Masters in Medical Physics program, MMP of ICTP, and now again reaccredited last month only, and now it is from 1st August 22 to 31st July 2027. It is reaccredited for 5 years. In Asia, we have accredited Catholic University, Seoul, Yonsei, and CAST, and now already the application for reaccreditation has come up, and we do give, the International Organization of Medical Physics gives the certificate. It increases the credibility of that program, standardization of the program, and this is a reaccreditation of this medical master's advanced studies of the ICTP and CST University has done. Just last month we did it, and this was accreditation board. This was just last month's visit to the board, to the hospitals to see the thing. And now we have the IOMP CPD accreditation. Also we do the educational program, training program, so that the standards are almost 11 programs have been CPD accredited. You must be attending some of the program, because CPD points you have to gain to maintain your certification. And these programs, the last program which was there online, this around 28 CPD points. Some programs are longer, 50 CPD points are accredited depending upon their the timetable, the lecture, the quality and quantity. Also IOMP accreditation for the residency program is there. And if your country do not have the certification board, there's an International Medical Physics Certification Board, IMPCB. They individually certify medical physicists if you do not have the certification board in your country, or they accredit the certification boards of your country so that the uniform standards are maintained. I will not go into details of this international certification board. And in Asia Pacific AFOMP region, now we have almost 9 countries which have their certification board, but it's not even 50% of the countries. And therefore, this has, see, IMPCB has certified the boards. They have accredited. One is a Korean Medical Physics Certification Board, Hong Kong Institute of Physicists in Medicine Certification Board, Hong Kong Association of Medical Physics Certification Board, and now being evaluated CMPI, the Chinese Society Taipei, and Bangladesh. So this is online process. Also, as I told, since 2016, we have started examination for certification of medical physicists where there is in the country they do not have certification board, and we have done that. And many countries physically, now we are doing it online also. And earlier we have gone there and then tested them and certified 150 candidates, and you can see that. Now, this was all about the medical physics education program, what are going on, what is the need. And as I said, medical physicists are not just required into the hospital, into the clinical field. They are the technology development, technology improvement. At the same time, the technology which has been developed, they are interlinked between the industry or developer and implementing them into the hospital, validating the technology, suggesting the improvement, so they can play a big role into not only just the delivery of the technology, taking care of the planning, not just as a dosimetrist of this thing. They can be into research areas development, technology implementation, validation, and research area. So there should be and there must be a more trust on the interdisciplinary approach of the medical physics education, so that we produce the medical physicists not for today, but for the tomorrow, and not just for giving a service in the hospital, but also the technology development, the implementation of the technology, validation of the technology, R&D. And therefore, As you know, medical physics is a bridge between medicine and physical sciences, and there should be more interaction of the medical physicists with other physicians, other doctors than just radiotherapy and radiotherapy. And this discipline has responded to the technologies, and that is how this all technologies of IGRT, IMRT, particle therapy in radiotherapy or MR-Linac, not only that thing, imaging technologies like MR, the PET MR, PET CT on this technology, fusion and all. And therefore, our medical physicists should work so that the reduce the burden of illness and disability due to the diseases. And what Halley's medical physics definition I talked about, it is prevention, and therefore most important long-term effect of the research will be identifying and the susceptibility to the diseases, and then to prevent. If you cannot prevent, diagnose at an early stage, therefore the chances of curations are there, and during the treatment the complications are as minimal, the smarter therapies, and there the medical physicists can play a huge role. And therefore interdisciplinary approach and our curriculum, our syllabus, our program must be developed so that we overlap, we have discipline like biomedical engineering and biophysics, and more of a biology needs to be included, needs to be taught, needs to be acquired during our training. And therefore, there should be a strong connection between this. You should not have a compartmentalization between these areas of biomedical engineering and other areas. So most medical physicists are working involved in radiation therapy. Most of the countries, if you look at India, almost 90-95% of the medical physicists are in radiotherapy. And therefore, the technological development which are happening into radiotherapy, the implementation is the onus, the burden is on the medical physicists. And therefore, in the oncology, the development which are taking place, so you can play a big role in this development, and also the what we call from the lab to the bed, lab to the hospital. So medical physicists are good at developing and refining technology, and they should remain the focus. Medical physicists are good at interacting the physicians and other scientists. And as I said, medical physics is not just the radiological physics or radiation. Other than that, also the medical physics technologies are there. So they should embark on the technologies of where implementation or the role of physics implications are there. And therefore, they should bring together these people. Very important, how to have a good collaboration with the biomedical engineering, and there are a lot of applications. And as I talked to you, that it is not just radiotherapy, radiodiagnosis, nuclear medicine, radiation protection, development of stethoscope, thermometer, prosthesis, all this pacemaker, the physicists play a big role into this thing, and they have played. We have played a big role, discovery of X-ray, their application, their use, their protection, magnetic resonance SPECT, all these the medical physicists have played. And therefore, our now the future, our education and the curriculum should focus on a personalization of a therapy. It is now tailor-made therapy we are moving towards. The patient requirement, patients, we do the molecular imaging dependent. So it's a personalization of a therapy, and there the medical patient, molecular imaging, molecular targeted therapies, particle therapies, clinical trials. Very important is a clinical trials also. Many a times we think it's the only job of the physicians or the doctors. But if you see a software developed, a hardware developed, a technology developed, who is going to validate that technology, who is going to implement, who is going to suggest the improvement. And these clinical trials, the medical physicist has to play a big role so that there is a feedback mechanism between the developer and the user and how the technology can be improved. No technology can come into the healthcare without the clinical trials, and the clinical trials which requires the knowledge, expertise of the medical physicists, they should take part into this clinical trial. A translation research, and we have on 24th September the AFOMP school webinar on this translation research, where medical physicists are developing the technologies, improving the technology, simulation of the complex system, artificial intelligence and data mining. It's a buzzword in today's era, and where the medical physicists can take part into artificial intelligence, let it be in diagnosis, let it be therapy, data mining, and so medical physicists should become a compulsory part of the clinical trials. That is very, very important. And incorporation of the imaging into the clinical procedures, which requires many consideration for the clinical protocol requirement, and it is involving radiation expert. The medical physicist should take part, and there becomes his important role, and more so because now we are moving to a tumor biology, and based on the biology of the tumor, theragonistic and many other terms, role of the medical physicist. And just I talked about translation research. We are going to have a AFOMP school webinar on 24th September, where you can see how the medical physicists and the team are working and developing various technologies. So medical physicists are extremely active in clinical treatment and basic research, but radiobiology is an area where the medical physicist can play a big role. It's a biology of the treatment is very, very important. And therefore, AFOMP has started an award on Dr. U. Madhuvanath's name for PhD in radiobiology, best PhD in radiobiology. How radiobiology is important, not only for treatment, but also for predicting the outcome of treatment, and any modifications are required. So the biology is very important. So they must involve into clinical radiation oncology trials, departments, and things like that. So great ability for designing and testing the models, let it be biological model, other models, Monte Carlo techniques and models. So these models testing, giving the result, who can do? It's a medical physicist. So it's a diversified thing. We have to have interdisciplinary approach. So medical physicists can play many areas into simulation of a complex and biological system, and in technical aspects, medical physicists can play. So therefore,
sorry for interruption, sir. I would like to remind you about the time.
Inter and transdisciplinary. It is not that we have boundaries or borders within that only we can do. Much more interaction with the physician, other clinicians, other scientists, basic scientists also have ideas, maybe into engineering colleges, Institute of Technologies, and therefore clinically and biologically relevant research is very, very important, which can give a direction, which can have an impact on a diagnosis and treatment. Such kind of clinically, biologically oriented research, medical physicists should get into the translation research. And therefore, our medical physicists should be prepared not for today, but for the future. And therefore, our education program should be tuned accordingly and more stress on the biology and other things has to be done. Many countries and many other organizations have embarked upon their curriculum, making it more interdisciplinary, making it more required for today and tomorrow. And therefore, AFOMP has also constituted a task group to prepare a model curriculum for the medical physics education in this part of the country. And because of too much of the heterogeneity, we arrived at a conclusion that we need two kind of syllabuses. One is a basic bare minimum to be, and one is an advanced. The countries like advanced countries can take up, and this two kind of model curriculum, basic and advanced, is going to come up within a month or so. ETC, the Education Training Committee of IOMP and IELTS, has prepared the draft for the 56 this document and has come up. But as these documents of the IAEA for entire the world, that is a low income and middle income, so they go for a basic things and all. Even AFOMP and ISTRO just in March 2022 has modified, and they brought out the core curriculum for medical physics experts in radiotherapy. They are going to bring out for radio diagnosis, work is going on, and for nuclear medicine, and this has been marked. And if you look at their change in the syllabus, you will see particle therapy, brachytherapy, principle of this unused sources, and your organization of the medical physics, leadership qualities, all those things they have included and research. Even AAPM has revised this medical physics education program, and they are stressing more on a computational method in medical informatics, research method, professionalism, biology in medicine and oncology, advanced physics, frontier of physics and opportunities outside medical physics, business aspects of the medical physics, and so many things. And if you see here, mathematics and statistical method, research method, professional leadership qualities, digital image processing, image reconstruction. So the education programs and the curriculum has to tune to the requirement of the future. A lot of things they have brought up. So future perspective in this thing is strengthening the medical physics education, and also that the medical physicist becomes more competent for not only today, for tomorrow. And many countries, it is mostly medical physicists, they work in radiotherapy, radiodiagnosis, nuclear medicine. But now this has to be the categorization of medical physicists, radiation oncology, medical physicists, specialized radiation, medical physicists for radiodiagnosis, nuclear medicine, interventional, and the research dissemination of the expertise, and that is what being done. This is a 28th AFOMP monthly webinar, and similarly we have a AFOMP school webinar of 2 to 3 hours on a specific topic, so that we are tuned, we promote the research, disseminate the knowledge, and people get promoted. And that is what we are promoting, the guidelines of IAEA, IMPCB, WHE, and strengthening the close relation with the other similar kind of organizations. And as I told you, that our curriculum and all those things include molecular biology, chemistry, computing, mathematics, engineering, technology, and strong interaction between academic medical physicists. See, medical physicists do not just are required into healthcare to take care of the radiotherapy or radiation protection diagnosis. They are needed into the research laboratories, into the academic universities, department, biomedical. Therefore, we should have a more interaction with the academic medical physicists into the IITs or institutes, biomedical engineering, computer IT expert, clinical medical physicists, and therefore to maximize the scientific and clinical output of the research, and it comes from the lab to the actually bed or into implementation, and that convergence of the sciences, convergence of the technologies are very much needed. And therefore, a multidisciplinary approach is needed. All fields are evergreen, but if you see the diagnosis and all, there are two levels of advances which are happening. One is a technological development, the hardware, and another is a data science, including algorithm and software. That's AI and all, early diagnosis. And you might have seen during COVID also, the AI has helped to early diagnosis of the pneumonia, because visible images by naked eye we are not able to diagnose, but the early changes, and therefore how the technology plus the data science coming together, and there's a huge scope for the medical phases in these areas. So optical imaging, near infrared imaging, terahertz imaging, microwave, EPR electron parameter imaging, fluorescent imaging, and also now we are moving to nanoparticle, nanomedicine, nano contrast media. We do not, we need today 20-30 ml of a contrast media. Now the technology will be there, very small nanoparticle, nano iodine, gold nanoparticle, nanolanthanide. So these technologies, this research area, you can be a part of implementing in clinical trial and development of this thing. Also, we have now dual energy for better algorithm, photon counting CT, image quality improvement, iterative reconstruction, other algorithm where low doses are there, nano CT, harmless CT, ball-to-win detector. So PET-MR, MR-MEG, fusion images, all these areas are open. Similarly, in radiotherapy, we have moved from 2D, 3D to 4D, IMRT, IGRT, SRS, SPRT, particle therapy, carbon ion therapy, and radiobiology. And you see how radiobiology is having impact from the normal conventional fractionation to hypofractionation to extreme hypofractionation. And in breast, now people are coming down to 25 fraction to 15 fraction to just 5 or 10 fractions. So this you can play. So the change the healthcare, pushing the frontiers of the technologies to make it a reality, multidisciplinary approach is very, very important, and their biology. Big data mining, application of right algorithm to extract valuable information, personalized scan, computer-aided diagnosis, machine learning, artificial intelligence. So many areas are there. Because many times when we discuss, we think that we are producing the medical phases just to take care of the healthcare system in radiotherapy. That too, it's a mandatory requirement by the agency or something, or diagnosis. It's not. Medical physicists can work into many areas and they can contribute. But however, the syllabus, the curriculum should not become so bulky, so heavy that the poor medical physicist student is unable to handle. The redundant subject, redundant topic should be taken away. And very important topic, the allocation of hours to the topics also should be rethought of the things. And now I will say that many institutions or many universities are going for this medical physics education master's program from 2 to 3 years, because to cover all this. And the residency program also from 2 years to 3 years in a specialized in radiation oncology or radiotherapy, or even 3 to 4 years. So that we have to think of. So the in nutshell, medical physics should expand their horizon beyond the traditional boundaries, dosimetry, QA/QC, etc., and become a part of this exciting multidisciplinary research team is very, very important. Network with important researchers of the medical phases, biomedical engineer, other IT specialists, learn more from the mentor, exercise leadership qualities, fill any knowledge gap by publishing, by reading, attending these things, support your groups and form small for supporting groups also, so that you can achieve. That is a special interest group you can form, and you can use the social media technology for exchanging the ideas, helping each other. And to be a successful medical physicist, skills such as strategic planning, marketing, good communication, these are very, very important. So you should be mentoring. And that is very, very important is interdisciplinary. You see, AAPM has formed a leadership academy working group for providing resources and course training in medical physics for furthering their skill as Medical Physics Leadership Academy, MPLAWU. Such kind of efforts in Asia Pacific region or any other part of the country can be done, and we can encourage them. So you need to change, you need to modify. If you do not, then you will be redundant, you will be outdated medical physicists, and therefore we have to embark upon all these areas of interdisciplinary subject. And therefore the first step in this transformation is accept the necessity. Once you accept that we need to change, we need to acquire more things and more knowledge, and then we can move further. We have published two papers. There's a dearth of medical physicists in radiology. Some countries do not have exclusive medical physicists for radio diagnosis or intervention radiology, and therefore this needs to change, needs to increase. So important that medical physicists are individual medical physicists are certified. The medical physics education training program becomes accredited. Medical physicists in the countries that do not have the certification program, that they can take help of IOMP or IMPCB and have these programs. And this gap between the knowledge which is going with the rocket space, and in last 10-15 years you see the technological development, our teaching and research, there's a huge gap. This needs to be grabbed because research has to increase, teaching has to be tuned so that we are par with the recent knowledge, recent this thing. And this is what I was talking about, the 24th September. This is democratic real-time radiation therapy, and Professor Paul Keel's lab, and their student, this is a Chandrima, is a medical physicist, but now in the postdoc she is doing. So how they can contribute, a medical physicist having after the training and the residency, how he or she can embark upon the technology development and all those things. And this is a team that will be there. So medical physicists as a health profession, through solidarity, continued efforts, and the acquiring the knowledge and skill, we will achieve our goals. With this thing, I invite all of you for the AOCMP 2022 being organized in Taipei during 10th to 12th of December into a hybrid mode. And I am constantly in touch with the organizers of Taiwan, and they are more confident that the travel, though today, as on today, 3 days quarantine is required, they're expecting by 15th of October that will go away and you can straightway join in person. And don't think of the tension and everything across the world. People can travel and in person participate in this AOCMP. If they cannot do because of any reason, they can join virtually also. So these things are the large amount of abstracts have been received, large number of faculty. If you visit, you will see to that. So I invite you to this AOCMP. So there is a need now to converging all this multidisciplinary subject, and the vision is a convergence. This is not a divergence thing. So medical physicists should think of converging all this technology subject and things so that we become relevant. We are part of this exciting medical physics world and the health profession development. And then we really make medical physics for sustainable healthcare theme of 2022. If we want to make it a reality, we have to converge and we do this thing. With this thing, I stop it here, though it was a little longer one. If there are any queries, I will be happy to answer.
Thank you very much, sir, for your very interesting and insightful presentation on the global medical physics scenario. Medical physics is a rapidly growing area needing a high degree of knowledge and professional competency due to the rise of complexity of the treatment procedure, increasing access to medical technology, and the requirements of coordinations between the discipline of medicine, physics, and biomedical engineering. Medical physicists have multidisciplinary vision of physics, otherwise the goals of the developing area are not met. Now we are going to question and answer session. Already in the chat box we have few questions.
Yeah, go ahead.
Sure, sir.
Not able to start my video. Okay, I'm not able to start. I don't know. Okay, now. Yes, please go ahead.
Okay, sir. The first question is from Dr. Mary John. Good afternoon, sir. Thank you. A very comprehensive talk on the global medical physics scenario. The education and training programs are slowly picking up and no of the medical physicists are also in the rise through not to fulfill the population, but the but the no of radiotherapy faculties required to fulfill the population necessity is not increasing at the same pace. So will it be more appropriate and realistic to calculate no physicist requirement based on the no existing upcoming diagnostic and treatment facilities?
Yes, rightly said that what is happening is that the earlier guidelines were that number of cancer patients and the number of medical physics required. But the complexity of the treatment, the equipment what we are getting and the QA/QC required, the time required, for example, implementation of the IGRT or implementation of the particle therapy, amount of time required for a medical physicist is a huge. So it is now not the number of the patients you are going to treat, but it is the complexity of the treatment modality what you are going to handle, and based on that thing and these guidelines and these calculation methods are available, publications are there, IAEA if you go, and then putting that complexity, you can find the number of medical physicists required. For a simple, say, cobalt therapy treatment only you have got, then okay, yes, for 400 patients, one medical. But if you have IGRT, you have proton therapy, the number of medical physicists required to have this stringent QA/QC implementation is a huge and time consuming. So we need. Similarly, many countries have changed their laws or incorporated that the radiology department or radiation department where post-graduation teaching programs are there medical physicists are mandatory, or the diagnostic procedure which are high radiation generator, which needs regular QA/QC, needs radiation protection program, the medical physicists are required. So these country specific and every country guidelines are there. Plethora of guidelines from IAEA, WHO, or the organization like ICRP and UNSCARE, and also the professional organization there. They need to be implemented into your country, and there the professional organization of the country can play a big role. Similarly, I am just, that is why am I asking that medical education program must be accredited, because when accreditation certificates is given, the accreditation board sees how many medical physics faculty trainers are there, how competent they are there, how many equipment or lab is there, to which hospital they have the collaboration, so that the medical physicist during their academic program takes a hospital training that is assessed. And once you assess that thing, you'll understand that many institutions do not have adequate faculty, or competency is not there, or they have not a good tie-up. So that is needed, and that is what again and again I am stressing. It is not just the quantity, but the quality of the medical physicists required to tune with the competency required as of today of a high-tech radiology, radiotherapy, or the delivery system. That is very, very important.
Thank you, sir. Another question from MD Mokhlisur Rahman. IAF provides guidelines for education on medical physics, but some countries could not follow the guidelines. Only MSc physics complete students work as a medical physicist. Can IAF take a step for that?
Okay, so now what is the domain and what is the thing of IAEA, or for that matter IOMP or IMPCB is IAEA brings out the guidelines, and these guidelines are sent to their member countries. All the member countries are supposed to implement all these guidelines, and all these guidelines are brought out such a way that even the countries of the LMI can implement them. So there needs to be the inclination of the country, or there must be trust that the country implements, and there the professional organization can impress upon their country or the agency of their country that these are the guidelines from IAEA and they need to be implemented. IAEA cannot force that this must be. That is not the authority, but they are the guiding guidelines they can generate and recommendation they can give, and they expect from the country that these guidelines and these are implemented. But it is again the member of the country, they should impress upon their authorities to implement these regulations or this bare minimum guidelines. Yes, there are some countries which just MSc, I know, but they have to change. And then that is what IAEA has said. It is bare, just even masters in medical physics 2 years without any structured residency program, they are not clinically qualified medical physicists. So they have given the ample guidelines. And again, I said, even if our residency program, audit has to be there. So guidelines are there, documents are there. It is we should be more proactive. Our association must be proactive. Our group should be more proactive to force upon the government authorities to implement this, because this is dealing with the health of the human being, members of their country, they are members of their population.
Thank you. And another interesting question from Dr. Mary John. Isn't it time to increase there no medical physicists proportional to the increase in the radiotherapy or diagnostic facilities?
What is the question?
Isn't it time to increase the no of medical physicists proportional to the increase of radiotherapy or diagnostic facilities?
Yes, now that is again the country to country. Yes, now for example, many a times when you are radiation safety officer, are you a radiation safety officer for the institution? And in the institution, if radiology, nuclear medicine, other, any kind of radiation is being used into the institution, you are responsible. But as of, to be specific in India, AERB asked that there must be level 3 or a full-time radiation safety officer for the radiotherapy department implementation. And you get recognized for radiotherapy, then you keep on working in radiotherapy. But no institution can stop or should stop them to use their expertise and knowledge for diagnosis, therapy, and other departments also. And that is what every country like Indonesia has made, or even Thailand there is there, or even Malaysia that is there, that the services of medical physicists are required in radiation protection implementation, that every country makes, then medical physicists will be employed and their services will be taken up. Because unless and until many countries you make it mandatory, that they don't go for that. So it's a country, it's not an international body can make mandatory in someone's country. It's a country's law or country's authority. Let it be atomic energy, let it be health department. They should make these things mandatory.
Another question from Jobairul. Is it possible to apply for SEP ESM registration, for instance, directly after being certified by IMPCB?
Yes. See, the CPD accreditation points and these things, what now our this thing, see, ACPSM is recognized as an accreditation board and their CPD points. Now, again, it comes, if you have in your country a certification board or certification body, and they make, okay, you acquire a CPD points in 5 years, maybe 60 or 50 or something to retain your certification. And in that thing, they make that the certification of CPD accreditation point given by these bodies. So you should, if it's the ACPCM is not there, you should bring this to notice of your country's certification board that, okay, you include this also because these are the points we are gaining it. Because in a country, for example, in India, you say, we say CPD points acquired from MCI, from the university or some other, they are accepted. So that acceptance we have to bring to their point, and then you can add on, okay, these are the agencies can be accepted. Okay.
Okay, sir. Another question from Safwat Jaman. As there is no certification board in Bangladesh, what would be your advice to certify a number of medical physicists currently working at the different institutions for a long time?
Yeah, exactly. That's what I said, that Bangladesh, you do not have the certification board, but you have shown the interest. Till that time, you know, IMPCB certification board is coming there, done it, even AOCMP 2021 has done, earlier also has done. So you can do. So if you want IMPCB certification, that is a level 1, level 2, level 3 examination. And now it is now Zoom based, virtually also you can do it. And many countries, medical physicists are applying for IMPCB certification. They are clearing the examination, and even the vivos and practicals are taken online, and IMPCB is giving the certification. Not necessary to travel also.
Okay. Another questions from again Dr. Mary John. To what extent the educational programs are capable of bringing out of the capacity of medical physicists as an interdisciplinary researcher?
Okay, now that is again an area of research, and Mary John can take this research back from the, and that is what Thomas Krohn also has done in one or two of his AFOMP school webinars, that the knowledge before the AFOMP school webinar and after that questionnaire. So you can design that after listening to or after attending this the AFOMP or any webinar or any school, how much knowledge gained, how much improvement has happened. People are studying, people are reporting, and one can undertake this study also. That questionnaire you give about the topic before we do the webinar or the school, and you do. And again, I will tell you, IOMP also AFOMP, IOMP school also is trying to bring out many schools, and they also started the CPD accreditation of the IOMP, the webinars and the schools. So evaluation can be done. So participant definitely helps, And that is what at least we have made it mandatory, that 45 minutes of attendance of the participant to get the CPD certificate. It is not just that you register and you get the certificate. No, we check it that how much time you were available, and on that verification only the CPD points are allocated.
Another question from Shojit Thomas. What about initiating medical physics education from undergraduate level programs extended to master's level?
Okay, so there are universities I have come across also that graduation to directly post-graduation, that's a 5 years program they have made it. That is once after 10+2, you enter into this thing. 3 years, that's a degree, and then 2 years, it's an integrated program of a master's. Some, like in a Korea, after your engineering or master's in physics or this thing, you enter to 5 years program where you get master's in medical physics and also PhD in medical physics. So those are the integrated programs are there. And that is what the ETC IOMP is trying, that as for the IAEA and WHO, that master's program is must. Some countries in Latin America, they have just bachelor in medical physics and they allow to work. That is not a fair thing. So you can have, even in Vietnam, earlier it was bachelor in medical physics, and there was a criteria of the university that unless until you have a one batch has to clear the bachelor in medical, you cannot start a master's in medical physics program. And they did that almost about 4 years back. They started bachelor program, and since last year now they have a master's in medical physics program. And who does bachelor in medical physics, they take part into master's in medical physics program. So you can have an integrated program. You can have a separate program of bachelor and master's, or you can have master's and PhD integrated program. Some cases also that is there, after doing a master's in physics, you can take an admission. For example, the ICTP program is after master's in physics, you have a 2 years program, including 1 year residency, and that is designed for third world countries. Though the program is taking place in Italy, the MMP program who does, they are not recognized medical physicists in Italy because Italy mandates that it should be a master's in medical physics 2 years and then 3 years residency program. But this MMP program is for the third world, like countries like Africa, Latin America, and Asian countries, and that has done a great job of this MMP program. And now they will upgrade that. So one thing is, where there is no medical physicists at all, no education program there, start initiation at least. And then and that is what when we ventured upon making a curriculum for the AFOMP region, we have come across that some countries, they need a very basic program. And some countries, they need a very advanced, that all particle therapy, radiobiology, and all data mining, this should be included. But if you include this, some countries like Myanmar tomorrow wants to start it, this will be too heavy because they may not have the faculty, the training facility. So we brought out this too. IAE also does the same thing.
Another question from Naoki Hayashi. Thank you, Dr. Arun. IEA published clinical training curriculum for imaging, nuclear medicine, therapy, specialized physicists. In addition, IAEA published core curriculum recommendation for graduate school, but I don't know the recommended CPD syllabus for the certified medical physicist. If you know that, please give us the information.
What is the last sentence? Is the type one?
IEA published core curriculum recommendation for the graduate school, but I don't know recommended CPD syllabus for the certified medical physicist?
Oh, see, for CPD, there cannot be a syllabus. It is a continuous medical physics and development. See, it's a continuous medical physics education. And this education and the certificate, who gives the certificate that we are doing? Say, for example, I told you that IOMP is accrediting the CPD programs also. And these CPD program can be a workshop, can be education program, and you attend that program and you get a CPD point. See, once you are certified medical physicist, to maintain your certification, you need to acquire continuous medical physics education. You need to acquire some points. Some countries say 60 points, some countries say 50 points in 5 years, some countries said every year 5 points. So those CPD points, where from you will get it? Like this continuous medical physics education program, like a workshop, webinars, and this, and they are accredited. So our program gives you 2 points. So you acquire. No, there cannot be a syllabus, there cannot be curriculum to acquire. Whatever recent knowledge you want to get acquired relevant to your profession, you go on getting and you attending those things. So that is there. So our AFOMP schools of 2 to 3 hours, every hour 2 points. So if it's a 3 hours, 6 points if you get it. So Jobairul organized that some recently program. So I think 28 CPD points if you attend all those things. So these CPD points are to be acquired to maintain your certification. So there cannot be a set curriculum or a syllabus for this.
Thank you, sir. I think there is no more questions. And now we are end of the session. I thank all the participants for showing their interest in the program. I again thank you, Professor Dr. Arun Chougule, sir, for very informative and excellent talk in global medical physics scenario.
Thank you.
And now I would like to thank again Dr. Chai and Dr. Rajni and all other the organizers for arranging this event. Now I would like to hand over this floor Professor Dr. Rajni.
Thank you, Jobairul. First of all, I want to thank Professor Chougule for such an elaborate and detailed presentation. Indeed, it's a very important topic, as a success of any profession depends on the education and training with timely upgradation. In today's era of globalization, uniformity and quality became very important for the, to get even a good status in a healthcare profession or a medical physics world. So I want to thank, at last, once again, I want to thank Professor Chougule for such an important discussion. I also thank Jobairul for such a dynamic moderation. And last but not the least, I want to thank all of our participants, as your participation and interest encourage us to work upon these online programs. And as Professor Chougule has already informed you, but I still want to upcoming programs. So it's so I invite you all to the AFOMP school on 24th of September. It's a very important one. I request all of you to join and get benefited with this very new and dynamic subject. Lastly, I want to invite you to the 29th AFOMP monthly webinar, which will be on October 6th. And lastly, I want to invite you to AFOMP 2022, which will be organized in December 10 to 12, Taipei, Taiwan. So we are hoping to meet you or see you soon on 24th of September. So thank you very much for being with us and making this program a success. Thank you, Professor Chougule. Thank you, Jobairul, and thank you all.
Thank you all. Thank you all for your patience, hearing, and all. All the best. Medical physics, the profession future is very, very bright if we maintain ourselves competent. With this thing, good wishes. Thank you, each one of you. Thank you very much.
Thank you, sir. Thank you all the participants.